My name is Sherry Jackson. I am a retired nurse now, but work per diem at the hospital 1 day a week. And I'm also a mom and a wife and a grandma. My story started in July of 2004. My husband and several of my family members went on a cruise, and we had gone to Mexico, Belize, and all down there, just having a good time. And on the way home, I told my husband, I said, my stomach hurts. And he said, oh, you're just being without a drink today, because I had a couple of them every day, which was good. But the closer we got to Fayetteville, the worse my stomach hurt. And by the time we got here, I was just extremely sick to my stomach. And I come in and just laid down and went to bed. And by Sunday morning, it was so bad till I couldn't eat, couldn't drink, couldn't do anything. I went and laid on the bed, and my husband come in and he said, do I need to take you to the hospital? And I said, no, I am not going to the emergency room. That is a no-no. I'll just wait. But I laid awake all Sunday night. I didn't sleep at all because I was afraid I was either going to stop breathing or I was going to just die totally that night. But Monday morning, I was actually so weak that they had to help get me dressed and get me down the steps and get me into the car. I ended up in the hospital at Highsmith, and I stayed there for 5 days. They thought I had some type of food poisoning from eating something on the cruise ship or while we were in Mexico. They just couldn't find out what it was. I was put on isolation the whole 9 yards, and I'm like, really, people? And the whole time my abdomen kept getting larger and larger. So finally they decided to move me to Cape Fear Valley. Went over to Cape Fear Valley, and the next day was a whole day of nothing but testing. They drained 3 liters of fluid off my abdomen and run path on that, and found out that I had non-Hodgkin's lymphoma. Dr. All was the one who come in and told me. And I'm sitting there, or laying there, and I'm thinking, he's got the wrong patient. This is not me. I have a stomach problem, but it's not cancer. I knew I did not have cancer. I even asked him, are you sure you're in the right room? And he just sort of looked at me like, Sherry. I left the hospital, I think, 1 or 2 days after that. Come back in and had a PET scan, at which time Dr. Manning told me that I was a stage 4. And he told me, I can remember, he said, you lit up like a light bulb. He said, I was impressed. It really was not good. He said, yours is in your lungs, your abdomen, and bowel. So it sort of encompassed my whole inside. And I said, okay, we can do this. Just tell me what we're going to do. The theory that nurses and doctors are not good patients is very true. I'm not a good patient. Dr. Manning always tells me, he said, you are one stubborn woman. He said, you could do anything you want to do. And I am so thankful that the good Lord seemed fit to give me a doctor who understood just how stubborn I am and how ornery I can be. But if I had to go anywhere to be treated for cancer, I would go nowhere else but at Cape Fear's Cancer Center. I received the best care that anybody could receive. And as a nurse, believe me, I was on top of what was going on. But the people there are so friendly. When you walk in, the volunteers who will greet you, the receptionist at the desk, always smiles. I do remember telling Linda one time, she's the receptionist at the front, she said, well, you look good today, Sherry. And I told her, I said, why are you lying to me? I said, tell the truth. I said, I'm bald-headed, I'm pale, and I said, I've lost a tremendous amount of weight. And she started laughing at me and she said, "But you look good today." And I said, "Yes, I do." So, the way they phrase things and talk to you is always nice. Even in the lab, they're always joking with you, talking with you, trying to keep your spirits up at all times. And like I said, my nurse was like out there just so jolly and everything's good with the world. And even on days when I felt really down, she always would make me laugh before I left. And as far as treatments, they're right on top of everything. The newest techniques, the newest treatments, the newest procedures. So it's not like they just know one kind. They know it all. And I would never go anywhere else. Why would I go anywhere else? I mean, my cancer was a stage 4. I'm still here. I had the best care that anybody could ask for.